In December of 2019, China alerted the World Health Organization about cases of an unknown virus that would go on to become the COVID-19 coronavirus pandemic. The coronavirus is not only highly transmissible, but it also poses a severe threat to the lives of older individuals or people with compromised immune systems. As reports of the coronavirus rolled in, news media started to compare it to the H1N1 pandemic of 1918, a horrifying outbreak that infected an estimated 500 million people the world over. Faced with this news, governments around the world were soon racing to implement emergency social distancing policies and secure their borders against the coronavirus. On March 9, 2020, Italy, the epicenter of the coronavirus in Europe, imposed a massive countrywide lockdown. With a few exceptions, Italians were required to stay in their homes. Shops and businesses deemed non-essential by the government were forced to close, and public gatherings of people quickly dissolved, starving the coronavirus of easy routes of transmission. Meanwhile, in the United Kingdom, as of March 23rd, citizens could be fined for attending public gatherings of more than 2 people. Previously bustling pubs fell silent. Town squares emptied, and the country buckled down in an attempt to flatten the curve. In the United States, the federal government published social distancing recommendations, and local municipalities began to impose stay-at-home orders. The usual heavy traffic in population centers disappeared, as many businesses closed to protect their employees. Citizens only left their homes to go for walks with their families or to buy groceries. Visual data is powerful, and there is so much to be learned from seeing the effects of those social distancing policies firsthand. Thankfully, technology has progressed significantly since 1918, so we don't need to take the risk of physically going to a location to take photos. Instead, we've set up a website so that researchers around the world can use our network of publicly accessible internet cameras to observe human spaces without needing to leave their self-quarantine. The world is grateful to those on the front lines who do have to courageously leave quarantine, to make sure that our hospitals and pharmacies are staffed, that our food supply chains are operational, and that masks, ventilators, and other medical equipment continue to roll off factory lines. We're all in this together.